Hello, everyone. Today we are very lucky to have with us at the office. I asked Dr. Ramon Payne to come to our office. He is an accountant first by university training, and after that, many years of practicing accounting, 10 years, he decided to dedicate his life to change the world by helping people with a wellness, make you have your life balanced in every single way. So many patients ask me a problem of TMJ. We have at the office, we have in the office one of the treatments that we have for grinding your teeth that affect TMJ is grinding your teeth, and what we're gonna do is to wear a night guard. So the dentist is gonna make a night guard. This is a night guard that are made at the office by Dr. Frank Richard. He's a prosthodontist at the office, and then you're gonna wear this at night. There is unfortunately many patients that they don't like, or the dentist is not adjusting the night guard, or the patient doesn't complain that the night guard doesn't work. But not only with the night guard, they have a problem. It comes to a moment that they're so tense that they need to have a massage therapy by a professional that is well trained, like Dr. Payne, that has a big amount of training in anatomy and physiology, but also he was teaching people about how to work with the muscles and the students how to work in massage therapy. So I wanted to ask a question to Dr. Payne about my patients when they said, what do I do when I have a limited opening with my mouth? Do you have any advice for patients that have that, like a very limited opening?
Honestly, I will say pretty much every human has a little bit of TMJ because just like with tennis elbow or frozen shoulder, all TMJ is pretty much overusage of the muscles involved. So that means that every one of us, including the photographer, I'm sure has some type of TMJ issues. Your masseter, your temporalis, your pterygoids, your medial, and your lateral, those are the four muscles involved with your TMJ network. So, as a massage therapist, we know massage techniques to pretty much take the stress out of those muscles, to massage the masseter. The masseter, again, is the strongest muscle per square inch in the body. Every massage therapist should know this. But again, just like Dr. Fanny mentioned, if they're not trained to be comfortable with working with the anatomy and physiology, because that matters. If they don't know what they're doing, all they're going to do is probably mess it up more so. So when it comes to the clenching and the clicking in anatomy and physiology, we have a term called crepitus. Any air that's alleviated from the body, whether it's farting or clicking, a lot of that type of noise is called crepitus. And when it's pretty much happening with the clicking, that means that some of the synovial fluid or some of the connective tissue is dysfunctional. And so that's with any joint. When it's not strong, just like when people have tennis elbow or shoulder, frozen shoulder, that means that it needs to be strengthened. So the night guard helps with structure and support, but then they have to pretty much strengthen the masseter and the muscles involved. So there's a variety of ways to address it, but also there's the mental aspect. We were talking about microtubules, and that's the aspect of consciousness. Dr. Stuart Hammeroff has been doing a lot of talks about it. NIH actually has plenty of articles on it. So your mind state has a lot to do with it because it influences the parasympathetic or the sympathetic. But then when it comes to the cytokine or the immune communication, if your mental health is a little bothered through medication, through your diet, through your boyfriend or girlfriend that has pissed you off, through the caffeine that have you taken, those are the elements that you don't realize can have an influence on your system. If you're in fight or flight mode, when you're coming into the dentist, you're already clenching your teeth and you're already kind of not helping with the healing aspect. So those are just a couple of ways to look at the quantum entanglement or the ways to influence the healing aspect of the TMJ. So, a massage therapist, a great dentist, but also understanding not only the structural aspect that can be alleviated with the night guard, but also the chemical aspect of massage, diet, and meditation, and all of those other modalities to pretty much help you have a better smile and to eat better. And if you again have your wisdom teeth pulled, your geometry is going to be off. So you're going to have to learn how to adjust your chewing habits, your smiling habits to compensate for that dysfunctional geometry. Again, tune in for further understanding about TMJ and other structural and unsympathetic ways of handling anatomy and physiology.
Do you have any exercises that you can recommend? Like we have in dentistry recommendations about pressing, let's say, in one side, and then you go against the muscle. Let's say you push your jaw to the left, but then your hand has to really push to the right to produce some kind of a release. I really don't understand too much because I am an endodontist actually, but in this channel we try to help people. And one of the advice I asked Dr. Payne, as he said to you, the mental status of us is important. He's been teaching me how to balance your life around it with a good nutrition, a good sleep, to do visualization, to don't get too upset about things that don't matter in the world. You know, we have to worry about the whole picture instead of a little things that we get worried that are really not important in our lives.